Understanding the complexity of skin lesions in complex regional pain syndrome.
So today is, I think we all agree, it's March 10, 2025. And I asked you if you would agree to do a instructional video today to help other people have CRPS. And the specific thing we're focusing in on are the skin lesions that come with CRPS. How do they develop? What about treating them? How do they respond to ketamine? Okay? And one of the things we have to keep in mind is that when you talk about something, a drug, having an effect, you got to be thinking about science. And the science is, well, how do we know it's not a placebo? How do you know she's just feeling good? She comes in to see Dr. Kirkpatrick with his white coat and his professor look, and that gets the ulcers to heal, right? You see this guy heal. They put their hands on somebody, heal. I don't think when you have open ulcers, as she has had, that if doing anything psychological is going to make them start healing almost immediately, drying up, right? Secondly, with a placebo, usually it's not repeatable. We've done it 5 times in her case, and each time it's very predictable. Even after the first infusion, we do a series of 4, right? Even after the first infusion, she says, "Hey, doc, look, they're drying up," and also especially the itching. This emphasizes the point with these ulcers, they are often associated with itching. And sometimes the itching is far worse than the pain. Scratching constantly. And they open the ulcers up even more to get infected and so forth and so on. And if they get infected bad enough, guess what? It could be life-threatening. You can get into, tissue not getting enough blood, or they just get infected and you end up with infected gangrene and all that sort of stuff. And it may even lead to amputation in the worst scenario. All right, so I just want to make it clear what the purpose of this video is. And then one of the other points we want to stress is that that CRPS is not curable. We don't have a cure right now, but we can control it. And particularly what we have found over the years, now going on 2 decades, is that usually these kinds of patients, they require more repeated ketamine infusions than other types of patients to keep the ulcers under control. Okay? And if you wait too long, you tell me, what happens if you wait too long before the next one? Tell me.
It's going to spread.
You were there.
Yeah, it's going to spread, and it's going to spread.
You have to stay on top of it.
You got to stay on top of it.
You can't wait until they start gaping up and start oozing all kinds of fluids and blood and so forth and so out of the ulcer. So you have to stay on top of it. Now, what we're doing right now, we got a study right now, what happens 5 years down the road. Do we have to do this forever? We're determining that long term, up to 20 years. We got patients, we're asking that question, what's happened 20 years from now? We don't have an answer to that. But right now, if you want to control the CRPS, looks like they're more high maintenance, you might say. Okay? Now, let's start with your particular case. So this all started back in what was the date this started? August something?
26, 2022.
August 26th.
2022.
And you were walking along and you tripped at work on a trash can, right?
Stood up and tripped over a trash can.
Yeah, right.
And broke the ankle.
most of the injury took place on the right side, down there. And a couple things happened which are typical for CRPS. Number 1, it started spreading up your leg. CRPS spreads. That's a big hint. A lot of neurological disorders don't spread. Secondly, you got this exquisitely sensitive light touch. I mean, blowing on the skin was painful, right?
Yes.
Clothing, just something just touching your skin was painful. There's nothing else in medicine that I'm aware of, and I've been at this for a little while, 40 years. There's nothing else that causes this extreme sensitivity. There's a word for it. What's it called? Allodynia. Right? So just those 2 facts alone point to the CRPS. Of course, you had other things. You had color changes, you had swelling, had a lot of other things So the diagnosis was clear cut, and this was associated with an explosion of ulcers. So one of the first things I want to do is to document, and we did a pre-videos on you before we treated you, so we're going to put those up to show you what you look like in terms of these ulcers and the way things are now after being treated for 4 days. And now this is the following week. In other words, we did the infusion last week. Now we're seeing what those ulcers look like. Okay. Lady, today is the 3rd of March, 2025. And the first thing we're going to do before your ketamine treatment here is do some baseline measurements. The first one we're going to do here today, at this moment, is your lesions, okay? And it looks like they've gotten progressively worse since I saw you about 2 months ago. Would you agree with me on that?
I agree with you.
All right. And so here we go. So let's start with your forehead up here. I'm going to move your hair around just a little bit. Get a close-up of the lesions there. And if I recall correctly, you got some hair on the side of your face.
And my neck.
On your neck. Now, would you be kind enough just to move your over so just on this side? See the lesions there? That's good. Excellent. Now I'm going to slowly scan your arm here. Just go down like on the outside here a little bit. There you go. Real slow. Get a good developed picture on that. And over here. And yeah.
There's one there that's
Right
infected.
there,
Right there.
Yeah. Whoops, sorry. You got ahead of me. There you go. Okay. Now, there was one that just starting over here. I think it's on your thumb. So everybody can see the way they start. They start as like little dots almost, right? And you got one down here on your foot, but I'm not going to take a picture of that. But it's the same. Then they get developed into skin ulcerations, like we're seeing right now. So what I expect from the ketamine is that these will start drying up, start healing, in other words. Let's take a look at the lesions, what they look like now, because we got videos of what it was before. So get in close, and let's take a look. This is what it is, and what you're seeing here is this is all dried up, right? It's all dried up. And when you came in, they were all red and angry, angry open wounds, right? And oozing fluid. Let's go over to the other side over here, and you can see that they're all dried up, right? And you start noticing that even after the first infusion, they start drying up, right?
Yeah.
Right? Now, up here you had it really bad. You help us out over here. She had it just a little bit there on her, just that. You can see open wounds over there. Now they're all dried up. You see that? All right. And we get the idea. That's fine. That's fine. Okay. All right, that's good. Okay, now they're all dried up. And of course, let's show down the legs here, because we did take a look at those last time. You look at the legs again. They're dried up, and what that is, it's healing, it's scabbing, just like normal people, when they get an injury, you get scabbing before, as it goes through the healing part. Now to the other leg here, so you get a good picture of that, of the other leg as well. Okay? And, again, the other thing is, and this is your opinion, and your opinion, she's not scratching like she was before.
No.
When she came in. Which can drive you nuts.
Insane.
Yeah.
Insane. That's a better
once in a
word.
while.
Insane, right. Now, we just did your pain thresholds just a little while ago.
Yes.
And you were untouchable when you came in this time. I couldn't touch you. The allodynia was that severe. Now you can see I can touch you. As a matter of fact, quite significantly so. Don't look at me, look at the wall.
Stop.
0.7,
Stop.
0.7,
Stop.
and 0.7. Now you can wear clothes without worrying about that. You can stand for a period of time. Your heels won't give out on you. So decreasing the sensitivity to touch improves function, period. And that's our goal. And one of the things we've stressed right from get-go, I'm not here to cure you, but what I am here to do is get you jump-started to do the one thing which will fix you long-term. And that's called a routine exercise program. That's talking about getting you active. Because activity itself can heal, can lead to healing, and you don't need more ketamine. Treat, but don't over-treat. And we go through all the ways. You've been educated in all the ways you can go to determine what direction you're going. And probably the one thing that we've told you to do when you do get into those heated pool exercises, right, is to determine your tolerance. So if the first day you get in there and you're only in there for 2 minutes, But a week later, now you can do it for 5, and the next after it's 10, you're getting better. You don't need no ketamine. You're getting better, right? Now you can't do some of the tools. We don't have all the tools we have here to measure if you're getting better or not. But at least you have something you can rely on, okay? And so we also want to emphasize the emotional part of CRPS. Did you know? Did you know? It's called the suicide disease.
That's the nickname.
Did you know that?
Yeah, I read that. Yeah.
All right.
Because of the excruciating pain that people experience.
Now the reason I'm bringing that up because this disease comes along with some big changes emotionally. Post-traumatic stress syndrome, major chronic depression, panic attacks, and there are going to be some other psychiatric things that happen, and you have to be sensitive to these other things that are going on with the patient. They can be a little hard to handle sometimes. Would you agree with that?
Oh yeah, I agree.
Well,
with that.
not much, but a little bit, right?
It puts a challenge out there. You know.
It's a challenge.
It's a challenge.
So it's a disease that's actually, in a sense, spreads, right?
Mm-hmm.
Becomes part of your life, and that's just the nature of the beast. Okay, Tara. Today is April. What did we say it was? 18th. That means it's 5 weeks since her treatment, her 4-day ketamine treatment. And what happened is for 2 weeks following the treatment, she went into, move it a little closer to her, would you? Okay, there you go. For 2 weeks, it was like she was in like almost a complete remission.
Correct.
Healing up, no allodynia, no real sensitivity to light touch and so forth.
Correct.
But then things started creeping back again. And what is really important, we're maximum out on other two important components in terms of managing CRPS. It's not curable, but it's treatable, okay? Or controllable. And those two things are, one, she's been diligent in following up on the heated pool exercises, trying to target 3 days a week, maybe 20 minutes, and complete, like swimming in the water, dog pedaling, doesn't really matter, okay? And number two, you got mental health providers looking over your shoulder, and they have been helpful. Do you agree with me?
Yes, I agree.
They help you control the anxiety, which all patients have anxiety, not to mention the depression, the post-traumatic stress syndrome, and all the other things that fall into the category of mental health issues, okay? But despite all that, what we can say is you're in a partial remission even though it's 5 weeks later. And the reason we know that, if you look over here on your left side, basically you're pretty much all healed up still over there, whereas they were open, gaping ulcers before.
Yep.
But in the meantime, you've had some breakthrough here on your right side, and you can see here you've got some wounds, you got some wound healing going on there, and you got another spot over here. But they're not diffuse like they were before. They were diffuse everywhere.
And that's wicked. I don't know if that's going to blip, because that's happened on my hand.
Well, we don't know.
It's going to blip.
And now, the other thing we can point out is on your mouth. That thing on your forehead is not there now.
No, you can
But
see
you got
this.
another area breaking out. There you are, right
That
there.
hurts. It's going
And
into my ear.
It's going into your ear, and you got
pain.
around your lip there.
Yeah, they were on this side, now they're on this
Right.
side.
And the bottom line is you got a lot of allodynia over here. I'm not going to prove it, but I can hardly touch you over here on this side. Also, don't you take off your slippers for a minute here. You got the classical findings of CRPS in your worst side. Has always been your left lower extremity, correct?
Yes.
If you notice on your foot here, it's that the classical findings of edema associated with CRPS. You notice how there's no swelling. It's all isolated, very highly demarcated down here in the lower part. See on the dorsum of your foot there, okay?
Yep.
On the top of your foot.
Right.
And that's classic CRPS. And of course, ketamine helps that, okay?
But with the plate, I do believe that plate is giving me the problem.
Well, that's hard to say because when it comes to CRPS, unless there's good evidence of ongoing acute injury, it's hard to separate those things out. But the point is you do respond to the ketamine.
Yeah, I do.
And we also know from our previous experience with this treatment is that staying in front of it instead of chasing after the symptoms is the way to go with her.
That's it. Correct. 100%.
Right. Now, I anticipate that she's, as I've said before, she just happens to be unusual, and for most of my patients, we can control them with less intervention, okay? We want to treat, but don't overtreat. But to stay in front of her particular form, with the lesions especially, it requires more intense ketamine treatment. So I am strongly going to make 2 points. One, you're not at maximum medical improvement, because we know the ketamine works, okay? It decreases the lesions, it heals them up, and also it treats the CRPS, which is the allodynia, and so forth and so on. And that's the reason why you're here today, is to prove, although you're not in a complete remission, you're in a partial remission still from the treatment we did last time. So I'm going to recommend that you have another ketamine infusion as soon as possible. I'll document that in my records today. And I anticipate, when I've had patients like this, that over time, if we can stay in front of it, that you may not need this once a month. It may be spread over 6 months or longer. We just don't know. We don't know. But we can't afford to let you fall behind in managing that you're in controlling your CRPS. Now I'm going to turn it over to you, sir, since you know the victim here. Tell me what your thoughts are. Do you agree with that?
I agree with that, because one thing about CRPS, it will spread, and this is what happened prior to the March treatment, that it spread to the point that it was out of control. Like I mentioned earlier, it's like right now there's a smoldering fire. If the wind picks up, it's going to take that fire and spread. And then once it spreads, it gets out of control, and the body responds to it 10 times fold and makes it worse, and exponentially gets worse.
Right.
And cure that.
That's a good metaphor. I agree with you 100%. Now, Tara, do you agree with that, and do you have anything to add to that?
I agree to that, but also I just know with me, not only I'm dealing with the CRPS, I'm also dealing with, the nerve damage in the foot, which
Right.
I know that's not getting any, it is what it is.
All right. So now, finally, the one thing I want to do, as I do usually, is I want to do a good survey on what your function is right now. So I want you to take, the vertical finger test, right? Mm-hmm. Take whichever hand you choose, put 2 vertical fingers in your mouth, and tell me if that triggers any pain. That triggering any pain in your face? Anywhere?
Just here because of my ear.
Because of your ear involvement? Right. Mm-hmm. Yeah, and we looked at that lesion just a little few moments ago. All right. Take that right hand, put it behind your head to see if that triggers any pain as best you can.
Yeah, I can't. I feel,
all right.
Yeah.
We'll ignore that phone.
I feel like it's going through my shoulder to my back.
Okay.
And I don't know if there's one on my back, but my back is hurting me.
I understand. And now do the well, first, before you take your right hand out in front of you, open and close as fast as you can. Fast. It's kind of stiff, huh?
Yes.
Now do the other side. I want you to take that hand. First of all, put it behind your head as best you can. Is that triggering any pain when you do that?
No.
Okay, good. Excellent. Take that hand out in front of you, open and close it as fast as you can. See how much faster that is? Mm-hmm. All right. It's always been, the CRP has always been more dominant on your right side, yes. Okay? So everything's consistent with that. Now the next thing I want you to do here is, I'm not going to, you obviously, I can touch you over here, and this is no problem.
Yeah.
But over here, forget it. I'm not going to touch you because I know you can't.
Yeah, the doctor just
if I even blow on it, it's going to cause you problems, okay? Yeah. So I'm not going to do that. Now, I want you to do this. I want you to take and rotate your right ankle as best you can, right, please? As best you can. Atta girl. Good job. Okay, so can you wiggle your toes at all?
No.
Not very well. Now do the other side. Take your foot out of the slipper. Rotate your ankle for me. See how much better that is? Right. Now, I want to see, again, like I want to do a good survey on you today. So I want you to go from that chair over to that chair. I want to see how you can do that. Well, no slippers. No slippers. Just best how you would do that, let's say if you were at home. How would you go from one to the other? Go ahead. Atta girl. Good job. Good job. So you're not going to go walking very far with that kind of...
No, I could do a couple of steps.
Yeah, that's about it.
Keep going to the
okay,
left.
Go ahead and take a seat, please. Not that one. No, the new one.
Oh, this one?
Yes, please.
Okay.
All right. Good. Now I want you to get up and see if you can transfer yourself over to the other chair, please. Atta girl. Good job. Okay, good. Excellent. Okay, good. So that's where we are right now, folks. I'm going to write this up, and we'll go from there. Unless anybody else has any questions, concerns,
or anything like that they want to bring up at this point?
I'm good with what we got.
Hey, Tara, how about you? Anything?
Yeah, I'm good. I'm just.
Okay.
I think I'm just tired. I'm just.
Yeah,
It's 3 years of this.
Right,
I'm
right.
tired of this.
Well, just continue with those other approaches, okay?
I do,
Talk
like
as
I
best you
said.
can talk. I would like to see, if at all possible, for you to get into 3 days a week and the heated pool. If it's dog pedaling, I don't care. But by the way, if you can do 20 minutes, you're
I
superwoman.
can stay in the pool.
Well,
I mean, I could
well,
do a lot,
but do some,
'cause I
do
don't
some moving
feel
around,
anything.
and I don't
Yeah.
care. Best would be if you don't swim, just dog pedal, okay?
Okay.
Got to keep that brain working and all the other part of your body,
If I can live in a pool, I would, because I don't
Yeah.
feel until I get out.
and continue to
That's my
control.
problem.
Yeah, continue to control the mental consequences of all this
That's
with
what
your
it is.
mental health providers, will you?
Yeah.